Hello, it's me, Henry. I have wanted for a bit to record my full uh hormone intake process for I don't know. One, it's kind of cool. I want to show that it's not like a big scary thing. That it's like a very normal, pretty easy process. And the third one is I want to. So yeah, I got this adjustable sort of positionable camera so that I could point it down here and be like, whoa, as you can see, I've got a bunch of different things. Wow. Um, Among these things is needles, obviously. So if you don't like those, go away. um, of course, if you are somebody who wants to do hormone stuff and you don't like needles, there are other options. There are pills, and there's also patches, I believe. I took the needle route because I have no aversion to needles. But yeah, so things that at least I need. I'm gonna say you for this as if it's a tutorial, but lots of different medicines are different, so don't take listen to your doctor. Um, so you've got the syringe, which does not have a needle on it. It's just the syringe, and then two different needles. One of them is larger than the other by quite a bit. It's kind of hard to see on this video, but this is the pink one. This pink one is much larger, and it's for drawing up the medicine. And then this is the blue one. It's for going in the leg. So I'm going to be injecting right here into my right leg. I usually alternate between each leg each week. So I will be injecting right into the upper thigh. And the way to find the spot is you sort of tense your leg muscle and you feel around for what the hardest spot is in the muscle. So for me, it's about right here. And that's like a pretty normal, like, even if you can't really tell the feel, um, this section is usually pretty safe as long as you're injecting into the muscle itself. And that's why you want to feel for the hardest part of the muscle. You want to make sure you're in the muscle. Um, so for me, it's about right here. Now, of course, when I inject, I don't want to be tensed. I actually want to be completely, untensed, relaxed. That's the word. So I'm going to be injecting right here. Uh, but we're not there yet. First of all, let's go over all our things. So, right, we've got the syringe, drawing needle, injection needle, and then this is the medicine itself. This is delestrogen or estradiol. I take 0.25 milliliters. Um, and yeah, I guess the only things left are um, the wipes. You're going to want two, not one, two alcohol wipes. Luckily, the ones I have come in packs of two, so. And a sharps container. We gotta put your needles somewhere, and you're not allowed to put them in the trash. That's a crime. Um, so yeah, first thing you like to do is just have everything kind of open and accessible. You don't want to be opening stuff like during as much as you can avoid it, just because you want to be touching as few things as possible um, to make sure that your hands are clean too. Don't want any of those yucky, yucky, yucky germs going up in your muscles and blood. So there are two things we're gonna want to swab. One with one swab, one with the other swab. Can you guess what the two things we're swabbing are? I'll give you a hint. One of them is my leg. That wasn't a hint, it was an answer. It should have been obvious. You have to swab the injection site. But there's one other thing you swab, and that's the medicine itself. We're going to be injecting into the top of this. There's a little rubber section here you inject into to pull up, and you want to wipe the top of that down with your swab so that there is no like germs or bacteria that actually get into the medicine or into the syringe itself. So I'm just giving that a good like full coverage. I'm getting the side too, even though I'm not going to be touching the side, just because you want to, better safe than sorry. And then I'm just going to take this and put it off to the side. We don't need that anymore. I'm actually going to put it on this because there's alcohol and I don't want it getting on my table. Okay. Now, I'm going to take the pink and I'm going to screw it onto the syringe before I take the cap off. So I want it nice and on there. And then I'm going to carefully take the cap off. And so, big scary needle. Now this thing is huge, massive. Your needle that's going into your leg will not look like this. If I stabbed myself with this, it would hurt a lot. It would probably injure me. I'd bleed everywhere. That's not what this is for. This is just for this. And so, I don't know how well this is going to translate on video, but I'm just going to stab this right in here. And then I'm going to pull it all the way to the top so there's only a tiny bit of the needle actually poking in there. And I'm going to turn it upside down. I want the needle, the tip of the needle, to be entirely submerged in liquid. I know it's going to be hard to see on video, but the tip of the needle is submerged in liquid, and you want to make sure that there's no air going into the needle. So I'm going to pull down. I'm going to pull down until the liquid is at 0.20, and immediately, again, it's going to be hard to see on video because my camera doesn't have autofocus, but there's a pocket of air right here because I pulled too quickly. And oftentimes, honestly, there can be air trapped in the needle. It's good to just pull all the way down and push all the way up a couple of times just to make sure that all the air that's already in the needle, already in the syringe, is getting out of there. So you just want to pull it a couple times. And then I'm going to slowly pull down. Again, this is not going to be the most compelling thing to watch. I'm actually pulling it down to 20, not to 25, because, yeah, you can't really see it, whatever. I'm pulling it down to 20 and not to 25 because the needle holds 0.5 in it. That'll depend on your needle. But so now when I take this out, right, if I pull a little bit, there is actually enough liquid to bring it down to 25. So there's currently 25 units, but yeah, 25 milliliters, or no, 0.25 milliliters, excuse me. And what I'm going to do now that I've pulled the liquid out of the needle, is I'm going to put the cap back on the needle. I almost did a very bad thing by trying to grab the needle itself. Don't do that. Put the cap on the needle, take the needle, and I'm going to put it right here in my sharps container, which already has a couple needles in it, as you can see. So, needle one out of the way. Liquid in the syringe. It's in there right now. Now I'm going to take my second needle. This is the injection needle. I'm going to put it on. Screw it on. Nice and good, nice and good. And before I take the top off of this needle, I'm going to swab the injection site. So again, I'm just going to feel to make sure I have the hard spot. It's right here. So I'm going to take my alcohol swab. I'm going to go in the classic outward spiral just to make sure that you're not getting any residue on there. You want the entire area. I'm going to go again. Entire area to be nice and clean and alcohol covered. Just in case. And now is the moment of truth. I'm going to take the cap off. So my hands are now covered in alcohol, so they're kind of wet. Come on, come on. There we go. So, as you can see, a lot smaller of a needle. This one is meant to go in your body. So, I've got my spot right here. I'm just going to go ahead and push down. And it really doesn't hurt that much. Like, it's a small, tiny needle. So then I'm just going to push. You're going to get some resistance because it's, pushing into hard tissue, muscle. Just going to keep pushing steadily down until it's all the way in. And then just pull cleanly out. I am bleeding a little bit. Usually I don't bleed. Not sure why I'm bleeding this time, but I'm just going to get a Band-Aid to cover that up. Got my needle right here. Just going to cover it right back up. Take the needle off while it's capped. God, I'm actually bleeding a lot. I'm going to grab a thing as soon as this video is over. Just screw the needle off. Put it right in the thing. The sharps container. And I'm done. The syringe itself, it's your choice whether to put it in the container or just in the regular trash. I put it in the container to be safe, but Yeah, the important part is that the sharp stuff is in the sharps container. But yeah, now there's 8,000 cc's of girl juice flowing through my veins, and that'll have me that'll keep me going for the next week. So I inject 0.25 once a week. Um, yeah, and eventually my beard will fall off, and I will turn into a woman overnight. That's how it works. No, I've been going for about a month, little over a month now, and not really seeing anything yet, which is normal. It usually takes about 3 months before you start noticing anything major. So yeah, thanks for watching my silly little video. Bye.